Welcome to Basic First Aid. Before you get started on this PowerPoint, please make sure that you have the first aid notes up. You want to be able to add the notes as you watch this video. Remember, always you are able to pause the video as you go along so that you can take your notes and rewind if you need to, if you've missed something. In this unit, you will be introduced to basic first aid, how to help someone in need of assistance, how to stop bleeding, choking, cleaning out infected eyes, and much more. When you go onto a scene of someone that has been injured, before you approach that person, please make sure that you remember scene. You want to stop. When you stop, check the area around you for possible dangers. Make sure that before you go to help the person, you're not going to be in danger yourself. Once you get to them, make sure that they are not exposed to anything that could cause them more harm. Check and make sure they are protected and they are safe. If you, while you are checking them, you don't find any obvious wounds, check for their breathing. Make sure they are breathing. And then establish priorities. Let's say someone is bleeding and they're unconscious and they're not breathing. Which one of those do you think you should attend to first? Once again, you want to stop and evaluate the scene. If you see down power lines, please don't run over there and get involved because it's something that could cause you great danger and great harm. Call 911 and get the professionals to help. If there's been a car accident, especially on the street, make sure you're not going to run into traffic and get injured yourself. Or if someone's hit a pole or a tree, that the tree or pole is not going to fall on top of you as you try to assist. So as you assess the scene, once again, evaluate it as we just discussed. Assess for safety to make sure you're not going to become part of the problem. And then prioritize your care. You're going to check the victim, check them for any medical alert tags, even if they seem coherent, because they may be in shock and not remember that they have a tag. Do a head to toe check. Ask them if this hurts or that hurts as you're checking. And if they are hurting somewhere, take note of that so that you can tell EMS when they come. And move them only if it's necessary. If somebody is laying in the middle of the street and traffic is blazing around them, you may want to move the victim out of the way. However, if they're in the car and they're safe in the car, don't take them out of the car. Only if the car is leaking gas or getting ready to start on fire. All right, it's not moving.
So, assessing the situation, are they breathing?
No, Rose, they are not breathing. And they have no arms or legs.
No, that's not part of it.
Where are they? You know what? If we come across somebody with no arms or legs, do we bother resuscitating them? I mean, what kind of quality of life do we have there?
I would want to live with no legs.
How about no arms? No arms or legs is basically how you exist right now, Kevin. You don't do anything.
All right, well, let's get back to it because we're moving them. Okay, too fast. Everyone, we need to pump at a pace of 100 feet per minute.
Okay, that's hard to keep track. How many is that per hour?
How's that going to help you?
I will divide and then count to it.
Okay, well, a good trick is to hum to the tune of Staying Alive by the Bee Gees. Do you know that song?
Yes, yes, I do. I love that song. First, I was afraid, I was petrified.
No, it's Staying Alive,
That's it.
Staying Alive.
You were in the parking lot earlier. That's how I knew you.
Staying alive, staying alive. Staying alive, staying alive.
You can't tell by the way I use my walk. I'm a woman's man, no time to talk. Words it loud, bringing more, been kicked around since I was born. It's alright, it's okay. You can look the other way. Let it go, let it go.
Staying alive, staying alive.
Yeah, okay, you didn't maintain 100 beats per minute, and the ambulance didn't arrive because nobody called 911. So you lost it.
Okay, he's dead. Anyone know what we do next? Anybody? Rose?
I have no idea.
Anyone else?
We bury him.
Wrong. And check for an organ donor card. If he has one, we only have minutes to harvest.
He has no wallet. I checked.
He is an organ donor. He is. Yeah. Give me some ice in a styrofoam bucket. Here we go. We search for the organs. Where's the heart? Precious heart.
I'm not feeling well. I need to sit down. Shower.
Are you okay?
Oh my God. Eddie. Oh my God.
Tell me why you had to cut the face off the dummy.
I didn't think it was very realistic in the movie. It turns out it's pretty realistic.
And to pay for it. Cost us $3,500.
$5,300 for a dummy? Okay, look, David, this is why we have training. We start with the dummy and we learn from our mistakes, and now Dwight knows not to cut the face off of the person.
That was not the correct way to administer CPR. You want to make sure the person is laying flat on their back on a flat surface. Give chest compressions at 100 beats per minute. Once again, using the song Staying Alive is the perfect rhythm to keep. Tilt their head slightly back by putting your one hand under their chin and the other hand under their neck and lifting slightly back. Continue until EMS personnel arrives. Let's talk about wounds. Please take your notes out and begin taking notes. A wound is a break in the soft tissue of the body. Open wounds result in external bleeding. This is called a bruise. A closed wound does not break the skin and can result in internal bleeding. External, you can see it. Internal, it's under the skin. How to care for circulation bleeding. First, put on gloves to make sure that you are going to be safe. Then first elevate above the heart after you've applied your gloves. Secondly, apply direct pressure. You want to make sure to stop the flow of bleeding. Wear gloves to protect yourself from disease. Cover the wound. Make sure that you cover it with something sterile and clean. And then apply pressure to stop the flow. If a body part has been amputated, put that body part on ice. I had a friend that was driving a semi-truck and it blew a flat tire. So he pulled over to the side of the road, was changing the tire, had the cement up on the jack, and as he was getting ready to take the tire, put the tire back on, the jack slipped and the truck fell on top of him and it amputated his finger. He was able to put his finger in a cup of ice that he had in the truck, stop the bleeding, and get to the hospital, and they were able to reattach his finger. These are the pressure points. A pressure point is a place where an artery near the skin surface lies above the bone. So you've got the shoulder artery that's above the shoulder bone, the neck artery, but don't push on the carotid artery. Then there's the arm, 2 points in the arm and on the upper thigh. Call 911 if somebody is bleeding profusely and you cannot get it to stop. Can you tell if a person is bleeding internally? What might some of the signs be? Only if it is near the surface of the skin, it might be coming from the ears, nose, or mouth, or vomiting. These are ways that you can tell that somebody may be bleeding internally.